Today is Wednesday, May 8th, 2024. I have another 10 minutes to go, so I'm going to read this article for my second reading for the day. This article is from Arizona Premier Surgery. I've never read this article before. I'm going to read it for you to practice English because I am Korean. I need to practice English on a daily basis. The title is Warning Signs You May Require Gallbladder Surgery by Dr. Albert Amini. December 10th, 2020, gallbladder surgery. For many people, their gallbladder is something they will never even have to think about. However, for some, it can be a great area of concern. The gallbladder is a small pear-shaped organ lying just under the liver. Its primary function is to store the excess bile created by the liver, which is used to break down fatty foods in your diet. Unfortunately, it is possible for this process to work improperly, affecting the overall health of the patient. When this happens, it might be best to have the gallbladder removed entirely. The expert team at Arizona Premier Surgery has extensive experience in the field of gallbladder surgery. That's good. If the following information appears to pertain to you, yes, I have like 6-7 gallstones, like a 1 inch in height or 1.5 inch, 1.5 centimeters, right? Consider scheduling an appointment at one of our offices in Chandler, Gilbert, or Scottsdale, Arizona. I've been to Flagstaff, Arizona. What are the signs of gallbladder issues? When the gallbladder isn't acting as efficiently as intended, it can create a myriad of undesirable consequences due in large part to the thick nature of bile. A buildup of bile can create obstructions that prevent the gallbladder from being emptied. If this happens, there are many possible outcomes, the most likely of which is gallstones. Gallstones are solid deposits that can form within the bile of the gallbladder. The presence of these stones alone is not cause for concern. However, if they become stuck inside the gallbladder or within any of its biliary ducts, it can often lead to inflammation, infection, bloating, nausea, vomiting, and/or pain. Outside of gallstones, there are many other conditions that could necessitate the removal of the gallbladder, such as biliary dyskinesia, choledocholithiasis, cholecystitis, and pancreatitis, right? Biliary duct. Common signs and symptoms that could signify the need to have your gallbladder removed can include sharp pain in the upper right section of the abdomen, nausea, vomiting, fever, bloating, yellowing of the skin, pain after eating, indigestion combined with bloating, heartburn, and gas. So far, I have none. Maybe bloating, I have a bulging tummy, but that's not a bloating, right? I have fatty stuff around my waist. How is the gallbladder removed? At Arizona Premier Surgery, we can perform what is known as laparoscopic cholecystectomy. For TAMI means incision. For our patients in Chandler, Gilbert, and Scottsdale, Arizona, incision and removal, right? Cut cutting. This is a minimally invasive procedure that involves one of our experienced surgeons making 4 small incisions along the abdomen. These incisions are then used in order to insert laparoscope as well as other specialized equipment toward the abdomen. The abdomen is pumped with gas, causing it to inflate and giving the surgeon much more room to operate. During the procedure, our team will use a camera and monitor to easily navigate and operate on the gallbladder. In Korea, I think they just make a small incision under the armpit and insert some long snake-like pipe and cut the gallbladder. I don't know. That's what I think. Once it has been removed, we will take a collection of x-rays to ensure any remaining bile or gallstones are not causing blockages. The recovery time from laparoscopic cholecystectomy is relatively fast, with most patients being able to return to feeling like their normal self within only a week of the procedure. Put your health first. Uninflamed or diseased gallbladder is nothing to take lightly. It's 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 nothing to take lightly. If you've experienced any of the aforementioned symptoms, consider scheduling an appointment at Arizona Premier Surgery today. It's not something to take lightly. It's nothing to take lightly if you've experienced any of the aforementioned symptoms, right? Here is aforementioned symptoms. It's nothing to take lightly. We have offices in Scottsdale, Gilbert, and Chandler, Arizona, each of which, I think this is wrong, not with, but which. Each of which is staffed with an expert team of general surgeons, assistants, and administrators in order to provide the highest possible level of care. Contact us today. Highest possible level of care. We say just highest level, but this is good term. The highest possible level of care. Highest possible level of care. Highest possible, right? Highest possible care. Highest possible care. The highest possible level of care. Provide the highest possible level of care. Contact us. So from this article, we learned that such expressions as the aforementioned symptoms is nothing to take lightly. And the symptoms are sharp pain in the upper right section of the abdomen. That's where the gallbladder is. Nausea, vomiting, fever, bloating, yellowing of the skin, pain after eating. That would be very bad. Indigestion combined with bloating, heartburn, and gas. So far, I don't have none, luckily. I wish to die without my gallbladder removed. Thanks. Have a nice, wonderful, beauty Wednesday today.